also very important, subject. So it's great to see you all. The former, well, I mean, we have Ngozi, who is our volunteer medical lead, and she will be hosting our, esteemed consultant. So welcome everyone. CAHN's Health Hour runs every week, the same, Zoom ID, and we will be live streaming on YouTube and Facebook as well. So we have the chat box features, but I'm sure Ngozi will give further information, so over to you, Ngozi.
Thank you, Charles. Good morning, everybody, and thanks once again for joining us on our Health Hour. I'm delighted this morning to invite Dr. Yakubu Kagarama, who's an ENT surgeon and otolaryngologist. Yakubu, you're going to have to say this because it's a bit of a tongue twister for those of us that are not in the specialty. I'm really delighted to invite him, and he came very early on. I think it was back in June, was it, Yakubu, that you came and gave the talk?
Yeah.
And it was fascinating. And this was when we didn't know much about COVID. And I think although we've learned quite a lot in the intervening time, we still don't know a lot about long COVID, because what we hear is people who have it mildly. We also have a lot of focus on people who have died, quite rightly, because that is something that has been really concerning with the whole COVID. But I think long COVID is underestimated. I know that my GP colleagues tell me that there are people out there suffering with this. And it's good for you to know, because I know that, I'll just tell a short story. When in my trust, one of the things we did was that we did antibodies on a whole number of people to see whether you'd ever been infected. And I had colleagues who had their antibody test who hadn't realized they'd had COVID in the very beginning and tested positive. So that meant that they'd had it. Now, that means that if you are having symptoms of long COVID, when you had a very mild infection, you might not even realize. So I think this talk is going to be really interesting as well. Yakubu used to be in Manchester, but he got stolen away to London, and he's working in Guy's and St. Thomas's. And if you recall, that's where our Prime Minister was. So we're honored to have someone from the team who made sure our Prime Minister pulled through. So over to you, Yakubu. Sorry, just to say, if you've got questions, please put them in the chat. There'll be an opportunity for everybody to ask questions at the end, and I'll facilitate that. So thank you, Yakubu, for coming once again. Delighted to have you.
Ngozi and Charles, thank you so much for your kind invitation once more. And I'm delighted to honor this invitation and to share with you my experience and what I know about long COVID. Now, before we go into the talk, I'm sure we all have had or known somebody that has died or has a serious COVID infection. So I will please ask us if you can just spend 1 minute silence for the over 120 people that have passed away, and to remember them and their families as well.
Them in the eyes and tell them you're doing all you can to stop the spread of COVID.
Right. So you would have heard about COVID infection and or maybe have experienced it. And you heard about the long COVID. What is a long COVID? As the name suggests, a long COVID is a situation whereby you had the COVID infection and then the infection has cleared up and you continue to have the same symptoms or even more symptoms more than 4 weeks, and in some cases months after the infection has already cleared. This long COVID is not something that we should take for granted, and I'll tell you why in a few moments. It can happen to anyone with mild or severe or moderate COVID infection. We're only just beginning to understand the gravity, the severity, and how common it is. Recent studies have shown that about 1 in 10 people will have the symptom of long COVID. And this is not just the older population that are affected, even young people can be affected with the long COVID. So I just got this news actually a couple of days ago. The WHO has published this, and there are thousands and millions of people that are suffering from this long COVID. This can affect people socially, and it has a devastating health and economic consequences in so many sectors of our life. And again, as I mentioned earlier on, when COVID came last year, we used to think, oh, it's just older people that are affected or people with severe comorbidity. But with the long COVID, it doesn't spare anybody. And studies have shown time and time again, young people with low risk, no comorbidity at all, they still present with symptoms of long COVID. And in some cases, it will be multi-organ failure. And this can persist more than 4 months in some cases. The reason why the long COVID develops is because your body will develop an immune response targeting vital organs in your body. And this can carry on for as long as we know. Because it's just a year now since COVID has been known. So we don't know how long this long COVID is going to continue, but we'll continue to see people in that in our clinics with long COVID symptoms. So one of the symptoms that long COVID would suffer from is the fatigue, muscle ache, shortness of breath, and headache. As Ngozi mentioned earlier on about her friend who didn't have symptoms, or maybe may have had mild symptoms that may think it's just hay fever or minor flu, but then never had the COVID test, and they think, oh, this is just an infection that is gone. And if you continue to have some unusual symptoms, it is likely that you're suffering from long COVID. So these are some of the other symptoms of long COVID. You may be having extreme tiredness, loss of breath. You may have chest pain or tiredness. Sometimes people will have memory loss and lack of concentration as well. You may have problem with your sleep. You may develop anxiety, palpitation, dizziness, pins and needles, pains in your joints. Some people will develop depression or anxiety. There are cases whereby people will develop post-traumatic disorder as well. It was tinnitus, earaches, hoarseness in your voice, paralysis on your vocal cords, facial nerves. You may be having feeling of sickness. Some people will have diarrhea, stomach aches, loss of appetite, and temperature as well. Other people will continue to have cough, headaches, sore throat, and loss of sense of smell and rashes. The list of symptoms is just, there's no end to it. We are still sort of gathering the different symptoms that COVID patients present with. And so it's the same case for the long COVID cases as well. So there are evidence that some patients continue to have lung symptoms in about 33% of cases. And this is over 4 months of diagnosis with COVID. Some patients will continue to have heart problems, pancreatic problem, and they develop diabetes from that, kidney disease. Some people are already on renal dialysis, kidney dialysis for that. There are patients that will have liver failure and spleen problem, and they will have to be on anticoagulants. Now we know, at least from the current study, that 2/3 of participants that have been investigated have had multi-organ failure, and this can be more than 2 of the above organs that I've mentioned above. And this is more common in people that have been intubated or maybe had admissions in the hospital. So what do you do or your family think that you have long COVID? There are lots of information on the websites. You can also visit the websites on your GP practice. There are lots of information on the NHS apps as well. And just call your GP if you're not sure what's happening. And the GP will be able to guide you. The GP may invite you for a blood test. You may need your blood pressure taken or heart rate or ECG. You may need your temperature taken. And some patients may require chest X-ray. And in some circumstances, you may be referred to the hospital. So if you have symptoms, don't sit back at home. So how we different ways that can help you. Now, the number of patients that have been admitted in the hospital, you would have seen on the news every day. And at one point in my hospital, at the peak of the epidemic, we had over 140 patients intubated. So it's here, the first picture, you will see the amount of tubes that goes into the patient. Patient may have the endotracheal tube, tracheostomy, nasogastric tube, central line, gastrotomy, feeding tube, urethral catheter. So there are tubes going all around your body. So sometimes even after you've been discharged, you may develop complications from the instrumentations, from the intervention that we've made to save your life. These complications may be devastating to you. Your life may never be normal. There are patients that will have to send them home on oxygen. There are patients that develop tracheostomy, so it means the voice will never be the same. There are patients that cannot swallow and will have to put what we call a gastrostomy tube. This is a tube that is fed directly from the skin of the abdomen into the stomach, so they cannot eat or drink through the mouth. You can imagine these patients, their life will be shattered. Some people have already been, probably cannot continue with their work, and the burden on the family is so much as well. So all it is that some people say, oh, I had COVID, it's mild, da-di-da-di-da. Just remember that there are people that it's not the same for them. And this is why it is very important that you think about other people, not just yourself. The fact that you are young or you're strong or you don't have any comorbidity and you probably just have mild COVID, but please just don't think about yourself alone, because there are millions of people out there that this COVID can completely change their lives. So in my clinic, this is just experience I've had in my clinic as an ENT doctor. Almost every week I get 1 or 2 patients that have had COVID infection, went through the intensive care unit, had tracheostomy, and then were discharged later. The commonest symptoms that patients present to me is loss of voice due to damage to their vocal cords, breathing difficulty due to wounds and scarring in their larynx, in their throat and vocal cords. This is my clinic here, and this is a patient. This was a patient that presented with breathing difficulty. And when I look into the patient's throat, there was a swelling there from an infection following treatment for the COVID infection. So I'm just using laser there to remove the swelling that is stopping the patients from breathing. Some patients may have a permanent tracheostomy. A tracheostomy is a tube that connects through the skin of the neck so that you'll be able to breathe. And it means you cannot breathe through your nostril. And then some patients will have to be fed with a feeding tube, which goes directly to the stomach. So where else can you get help? You can get help from the NHS recovery website. If you think you may have long COVID, there are lots and lots of online patient group support as well. And it's always good to share your experience with other patients as well, as you may get some help there. These are the frequently asked questions that people ask. What is a brain fog? Now, a brain fog, it's a situation whereby after contracting COVID, you may be experience periods of confusion. It may be headache. You may have short-term memory loss. And in some severe cases, patients may develop psychosis and seizure as well. Some patients may have lung problems, and this may be a chronic cough, shortness of breath due to fibrosis of the lungs. There are patients that have developed lung clots, and they are on permanent blood thinners like warfarin or aspirin and other types of blood thinners. Again, patients have developed cardiac problems, chest tightness, inflammation in the heart. Other patients are left with permanent kidney failure and have to be coming to the hospital twice a week for renal dialysis. There are patients that they have to be on blood thinners permanently as well. So it's not just coming out and it's end of the story. It's clearly from COVID, something that we need to recognize that, and at the same time we need to understand if this occurs, what to do and where else to get help. So what investigations would you need if you think you are developing long COVID symptoms? Speak to your GP. Your GP may invite you to take some bloods. The blood count will show whether you have some infection, and it will show the white cell count. It will show whether you are developing any anemia, explaining the weakness. It may show us whether you have some antibodies or whether your immune function is strong enough. You may need a kidney function test, liver function test. A C-reactive test may be done to show that whether you have continuous inflammation in your body. In some cases, your GP may send you for physiotherapy. You may need some exercise tolerance tests. And some patients may require chest X-ray, and they may be issued with oxygen permanently at home. So please remember, there are things that can be done. Do not stay quietly and silently at home suffering from this long COVID condition. If in doubt, speak to your GP, and quite often there will be some solution to that. So this is just the last slide from this, and after this, we will open up for discussion and question and answers. These are my team of nurses and doctors that I run my clinic at Guy's and St. Thomas's Hospital here. Thank you very much. So it's time for questions and any chats now. If we have got plenty of time for that.
Thank you very much, Yakubu. That was really helpful. Do you want to unshare your screen?
Yeah.
Thank you. Thank you. That was really, really helpful. And I think it addresses one of the issues when people asked us, remember very back in January when we were saying why we'd had the vaccine. One of the things I tell people is that it depends sometimes on your experience. Now, if you are seeing patients who have lost their voices, who are not able to breathe apart from through a tube, who are having to be fed directly into their abdomens, it will influence you. And unfortunately, people haven't been allowed into hospitals, people who are well and who haven't had COVID, so they really haven't seen some of these patients. And so it's so remote from them. And that's why I think at the beginning there was some hesitancy about taking the vaccine. So thanks for sharing those photographs, because it's very sobering what people have gone through with this. Someone's put in the chat, I think your spell check changed brain fog to brain frog. So someone has said that it's brain fog. Yes, thank you very much, Teresa's Galaxy, for pointing that out. The vagrancies of spell check means that there's sometimes you want to say one thing and your spell check decides it's something else, but thanks for pointing that out. Okay, we've got a question about, can you still have long COVID if you've had the vaccine?
Very interesting question. As you know, the vaccine role has only just...
So Yakubu, just before
we don't even know the number of people that have had vaccine and developed COVID. So right now, we don't have an answer for that. And I think if I give any answer to that question, it will be a guess, unless if anyone in the audience has an answer to that. But I don't think we have sufficient. to answer that question. But for what we know is that the vaccine prevents you from getting severe disease.
Okay. Yakubu, there's something wrong with your audio. Yeah, it keeps cutting out.
Right. So
Okay.
I'm going to change to my other
Thank you.
handset now.
So another question is, when you've had the COVID test and you've had COVID-19, this is very disconcerting seeing you in two places, Yakubu. Okay, sorry about that. I'll say the question that when you've had COVID, when can you get the test? When can you get the vaccine if you've already had COVID? You're on mute.
Yeah, can you repeat it again?
If you've had COVID, the question is when can you have the vaccine? How long do you have to wait?
I think from what I understand, it's about.
Yakubu, it would be helpful if you mute one of your devices because
Right.
we can hear you echoing.
I'm gonna leave with the other one now. There you go. Right, you hear me now?
We can hear you well. I think it's your propensity for multitasking, Yakubu. You're trying to do too many things at the same time. Okay, we can hear you.
The reception is awful here, though. Right. So when can you have, I think people advise to wait about 4 weeks before you can have the vaccine if you've had COVID infection.
Yeah, I think discuss it so that you get the, we know that you have to have you can't have it immediately if you've had COVID. There's another question here about people who have had typical COVID symptoms but didn't get tested and have had negative antibodies. Can they be diagnosed as having long COVID? So the situation is that there's somebody who felt they had mild symptoms. They didn't end up going for a test. Can they still be diagnosed as having long COVID?
Yes, you can, because I've had some colleagues that have had COVID and they were initially antibody positive, but after a couple of months, they were antibodies negative. So if you didn't have the antibodies tested initially and all the symptoms fit with COVID, it may have been that you had COVID before and then the antibodies later on disappeared in your system. And if you continue to have these symptoms, it is possible that you're suffering from long COVID because we're not aware of illness to give you this kind of.
Yakubu, you're breaking up again.
Hello?
Yeah, I can hear you now, but you were breaking up. I'll just repeat what you said.
I'm just going to join completely on a different computer, Ngozi, and then turn this one.
Okay. Well, what I'll do, I'll just repeat your answer because I got part of that just in case. So what Dr. Yakubu said was that the question I asked about if you had mild symptoms and you didn't get tested, that whether you can still have long COVID, the answer is yes. Because if you remember right at the beginning of the pandemic, the symptoms that they were asking you to have a test for were very, very limited. There were if you had a temperature, in fact, symptoms like loss of taste and smell weren't in the very, very early first wave, because I had colleagues who had lost taste and smell and were wondering what that was about. And it was only later on when they found that there were lots of people who had these same symptoms, I was added to the list, and more things that we've understood it a little bit better. So that means depending on when you got it, whether you were encouraged to have a test at that time, you might not have had a test. And obviously if you had it, you can still have long COVID. And Lady M, you've said that you didn't hear the answer about getting long COVID if you have the vaccine. So what Dr. Yakubu said was that we don't know enough about it yet, But what we do know is that the vaccine seems to prevent death and serious disease. But long COVID, Yakubu, have you seen people who have had mild disease and ended up with long COVID?
Yes, and this is what the study is showing now, that a lot of patients will have just mild disease and they will develop long COVID. You don't have to have any hospital admissions, and you can actually go on to develop multi-organ failure. And this will include like myocarditis, kidney failure, diabetes, and lung fibrosis. There are patients that they've been having like mild shortness of breath, didn't know what it was, and then had a chest X-ray, and the chest X-ray showed scarring and fibrosis as well. So the evidence is overwhelming now that with mild disease, you can still suffer from long COVID.
And I think that also will ensure that, the guidance has been that even once you've had your vaccine, that you continue to practice face, safe, and space, because we need to make sure that lots of people have it. So that's why, even though you've had the vaccine, we need to ensure that as many people as possible have it, so we can protect everybody, more and more people from getting this disease. Because the vaccine, as you know, even the most efficacy, they have about 95% efficacy. So you're not 100% protected if you have the vaccine. So the only way we're going to beat this is to have as many people as possible to be vaccinated.
Yeah.
So we've got another question from Charles here. Are you seeing any particular population groups come into your clinic with long COVID?
Again, here in London, we know that the Black and ethnic minorities have been hit harder with the COVID infection. So I would say 90% of patients that come back with complications in my clinic are Black and ethnic minorities. The only very few Caucasians that I see with the complications are the ones that are morbidly obese and have some significant comorbidities. But other than that, yeah, the BME group, unfortunately, have the worst outcome.
Okay. Can I just ask you a little bit about that, Charles? So from what you've seen, although we've been told that there seems to be more BME people having the severe symptoms of COVID, if you take away deprivation and socioeconomic status, do you think that will still bear out?
I think, is that my question there, was it, Charles?
Yes.
Yeah. I think if you take out that, it will even out, because if you look at in the African continent, although the data is not very accurate, but actually it was predicted that Africa will be completely ravaged by the COVID infection, but it's not the case. We've all got friends and families back home. They're not just dying left and right and center from COVID or getting severe or admitted in we know that it's not as bad as the BME in the UK or maybe even in America affected regarding that. So that makes me think that it's because of the socioeconomic situation. And also here, remember, people in the front line, whereby you're more likely to catch the virus, are the BME. If you come to your hospital, the cleaners in my hospital, I would say probably 99% of the cleaners in the hospital are BME. The bus drivers, just anything like that that's going to put you in front to catch the virus is going to be a BME. So it doesn't require any genius to work that one out. The reason for that. So yeah.
Thank you. I think it's important to clarify that.
Yeah, there's nothing genetic about it. It's just really because of the exposure and in the socioeconomic situation.
Thank you. Okay. The other thing I was going to ask is, in terms of the ENT, because that's your specialty, isn't it?
Yeah.
What are the specific different things that you're seeing from an ENT perspective? Because you talked about nodules on the voice box.
Right. So in ENT, there are two groups of patients that present to us with complications. The commonest ones are the ones that have been through the intensive care unit and they have intubation. So normally when you have intubation, after a week, the anesthetist will decide to take the tube out and then replace it with a tracheostomy, which is a hole in front of the neck. And the reason is because if we leave the tube in your throat for too long, there is a risk of developing scar on your vocal cords. But because with the COVID, a lot of the patients are very sick, they have to leave the tube, the endotracheal tube, longer for up to 2 weeks. So when it comes out in the end, people develop scar on the vocal cord, and that causes breathing difficulty. So the commonest problem that I have with these patients are breathing difficulty, and it's a situation we call stridor. I have to take the patient to theater every week, once every week, in order to help them breathe because of these complications. The second complication that I get is loss of voice because of scar on the vocal cords as well. And then sometimes we develop what we call granulation. It's like a fleshy infection tissues on that. So those are people that have been intubated. There is another group of patients that have not been intubated. They may have been admitted in the hospital. Some, they've not even been to the hospital, but they had COVID infection. So they develop paralysis of their vocal cords. So they will present with loss of voice and they present with swallowing difficulty. And we know that COVID infection can cause microvascular accident. So it may be like mild stroke they have, and that presents with paralysis of the nerves of the supplies of vocal cord. And sometimes it's paralysis of the facial nerve. And some people will have hearing loss. And there are patients that have got loss of sense of smell as well. I think the vast majority has loss of sense of smell. And these patients may not have any other symptoms apart from the loss of sense of smell. We now know COVID is one of the #1 causes of loss of sense of smell. Thankfully, a lot of the patients will regain their sense of smell and taste once the infection has settled down. And this could be 3 months down the line.
Have they found any explanation why they've lost their sense of smell? Why does it affect it?
Right. Viral infection is one of the commonest causes of loss of sense of smell. So the nerves that perceive the smell is inside your nose, at the roof of the nose. And so it's just directly under the brain. So if you have any infection that causes inflammation and damage to the lining of the nose, that can damage the nerve as well. So initially we thought that was how the COVID infection causes loss of sense of smell. But now we know that it's not just the lining of the mucosa, it damages the nerve itself, just like it damages the facial nerve or the vocal cord nerve. So, which is why even when we give you nasal steroid spray, it doesn't change much. It will just be with time, your body will recover from that.
What about the taste?
So taste. Now, when people say they lost the sense of taste, but actually in reality, it's the smell that they've lost. And the reason is because most of the food that we eat now is the flavor. And if you cannot smell the flavor, you find that you can't taste the food. But actually, when you put salt in your mouth, you can tell whether it is salt or sugar. So that is taste. That's completely different. So sometimes it's a bit confusing when people say, I can't taste, doctor. And it's because really you cannot smell the flavor of the food. But if you put bitter leaf in your tongue, you will be able to taste it.
Okay. All right. Okay. Yeah. It's just not something that you'd want to come your way. So that I just, implore everyone to just keep protected and, have the vaccine, because obviously these are really severe complications from, I know some people have had a really mild illness, but these are some of the features that we don't hear about, because obviously the government's focus is on the number of people that have died and the number of people that are being vaccinated. But it's really important for people to know that these are some of the really serious consequences that can happen to you if you get the infection. One of the things that someone has asked is that if you have underlying health conditions, do you tend to see worse outcomes in people like that?
Yes, unfortunately, yes. And with the Black and Asian community that I've seen, the vast majority of them, almost every single one of them, has got high blood pressure, diabetes. Those are the commonest and then obesity. Those three are toxic. And almost invariably, these patients, they have worse outcome. That is, if they survive, and even after they get their discharge, their life is completely turned upside down. Yeah, I've had a few patients say that they don't feel like, you know, they want to live anymore because of the situation they're left with, because they can't do anything. They're just completely housebound. And these are people in their prime age, say in their 50s. The youngest I've had in my clinic with these complications is a 22-year-old a Black woman who has developed a severe complications, and her only comorbidity is just obesity, but otherwise no other health issues. So you really have to look after your health. You know, there is this weekly exercise, was it health clinic that the CAHNs run. It's very important. It may seem very minor, just workout, exercise, but every little exercise that you do, it will make a huge difference to your system, your body system. So just the key is really to maintain your health, the exercise regularly, not just once a month. You do a few jumping up and down and you forget about it completely until you feel like your tummy is busting and you go back doing it again. That probably will not change much. So make sure you join the CAHNs, the exercise workout sessions. It's very good, actually. I've learned a few things from that myself.
Oh, good. I'm pleased you described, I heard you describe the beginning, someone in their 50s at the prime of life. Great one, great one. I suppose it depends on where you are. For some people, my daughter, people in their 50s are over the hill. Anyway, the other question I've been asked to ask is, do you think your immune system can return to normal after long COVID?
In some cases, it will return to normal. In majority of cases, it will return to normal. What we don't know is, for the ones that the immune is completely deranged, how long that is going to continue. Remember, it's a year now since COVID, that we come to know about COVID. So we don't have long-term data to answer that questions. But the vast majority of people, the immune system will recalibrate itself and then come back to normal. And thankfully now we're having lots of medications and drugs that will be helping with these cases. We know steroids, dexamethasone is very good. There's the monoclonal antibodies as well, which is very expensive, but the steroids, the dexamethasone, I think is £3 or less than that per dose. The monoclonal antibody, it's about £500 to treat a patient. But more drugs will come in. And the main reason why these drugs help is because it controls the immune system, your antibodies attacking your cells. Because this is what happens. When you have the virus infection, your body naturally releases antibody to kill the germs. But the germs are very clever. They try to hide. They try to mimic your cells. So some of them will mimic the heart cells. Some of them will change and appear like kidney cells or lung cells, and the body will interpret that as virus. So this is why your body will develop immunity and start damaging your other system. And the reason why people develop multi-organ failure is because, again, the virus mimic these cells, and then the body raises a high immune system, and the consequences of that immune system is what kill people, really, not the virus itself.
Okay, thank you. I've got a brilliant question here about if you're graded as high risk, is it still advisable to take the vaccine? And before you answer that, I'll just tell you a little story. Someone came into my office, one of the cleaners actually came into my office, and because I've been, trying to encourage as many people as possible to have the vaccine, I asked her, if you had the vaccine? We usually chat quite a lot about different things. And she said, I haven't, because I've got diabetes, I've got high blood pressure, I'm a little bit overweight. So because of these health issues, I'm not going to have the vaccine.
Wow. So
Yes.
really, she is the person that should be having the vaccine. She should be on the front of the line to have the vaccine. The vaccine is safe. I've had 2 doses luckily within 3 weeks. That was that first week before Boris Johnson took it away. For right reason now, we can see. So I had my vaccine on the 16th of December, the Pfizer BioNTech. Didn't feel anything, just slight soreness in my arm. And then the second dose, I had it in January, 6th of January. So for the whole day, I felt slightly tired and feverish. And I had a rest for a couple of hours, had my siesta. I didn't even know that it was the vaccine because I thought maybe I'm just coming down with a cold. I took paracetamol, and the next day I felt fine. I went swimming. I did 50 laps in the swimming pool the next day. So no long-term effects regarding that. It was after when I was speaking to my other colleagues that have had the vaccine, they said, oh, they experienced the same thing, which we know about. It means that it has mounted some antibodies to fight the virus. So it means it shows that actually there is some difference now. So to answer the question, if you are the high risk group, this vaccine, you should be in the front of the line. Because if you get COVID, you probably have no chance.
Thank you, very sobering. And if you do have, apart from having the vaccine, is there anything else that you feel that might protect people who are at high risk? Will vitamin D help?
Yeah, the vitamin D, there is overwhelming evidence that vitamin D does help and build up your immune system. Vitamin D deficiency is very common. It's more common in black skin. And the reason is because with the melanin, the black hormone in your body, the melanin, stops you absorbing the vitamin D from the sun. And vitamin D is one of the constituents of immune system that fight infection. So it is advisable to take 1 tablet of vitamin D. Make sure you get enough sunshine as well. Go have your sunbathing, get your tan properly. Yeah, if you're not tan enough. So yeah, vitamin D. And also multivitamins, vitamin C. And there are lots of food actually that contains vitamin D. There are lots of them there. There's mushroom, it contains vitamin D. And also even bones. When you have your chicken, make sure you eat the whole bones in it as well. So we all have our source of having vitamin D.
Thank you so much.
Yeah.
Now, you just talked about dexamethasone steroids. That was really, a really good drug to treat some of the symptoms of COVID.
Yeah.
Yeah. I know that's for when you're in hospital, isn't it? So
yeah.
Can you explain why we're still seeing really high rates of mortality, despite the fact that we've got support from the intensivists, we've now got the additional knowledge that dexamethasone helps. We're still seeing quite a high mortality.
Yeah, because there are lots of things that we still don't understand about this. The mortality actually, considering the number of people infected, was higher at the start of the COVID, the first wave, because during the first wave, we were only focusing on the lungs. And then now we know that it can cause stroke, it can cause clots in the brain, it can cause multi-organ failure. So a lot of patients are having dialysis early on. They're having some blood exchange as well, blood transfusion. They've been placed on anticoagulant long-term, but the mortality still remains high, especially in people with other health issues. And again, we haven't got the magic bullet yet. Yeah, but on the whole, people come out of the hospital better than at the start of this wave when it started last year.
Thank you. And I think the other thing I was going to say about the vitamin D, that it's important for us to take it because people haven't been out as much as possible, as much as they have in previous years. We haven't been exposed to sunshine because we've all been indoors. So I think it's an adjunct to make sure that we're healthy in any way we can. I don't think the advice is that it treats coronavirus, but what you need to do is keep yourself as healthy as possible. And this is one of the ways that you can. And I have just checked up the dose of vitamin D for you, and I'm going to write it in the chat box. And Charles, you want to say something about our vitamin D?
Yeah, thanks, Ngozi. I think for those who live in Manchester, so that's within the city of Manchester, we will be running a vitamin D campaign. It's more about, you know, a spring wellness pack. So that'll have a tub or a pouch of 120 vitamin D tablets. It will also have a face mask, hand sanitizer, and then some information leaflets, you know, within the bags. And then we will be giving that through groups so that they can give that out to their members. So if you live within the city of Manchester and you know you're interested in receiving a pack, then by all means, you know, drop us an email, info@CAHN.org.uk. I mean, because of the low levels we have, we were able to negotiate and we've had sign off. So we've purchased the 2000 IU, you know, tablets. So that's what we're going to be giving out. And then also we're in conversations with the maternity team at Manchester Foundation Trust, where Ngozi works, because I think last year there was a fatality. So a Nigerian baby girl that passed, you know, away due to low level of vitamin D, you know, well, vitamin. So, you know, there is an ongoing work to try and get, you know, midwives, especially health visitors, to be given our free, you know, tubs as they do their rounds. So I don't know if you want to share it.
Yes, I do. It was really unfortunate because what happens is that if a mother lacks vitamins, that means that the baby will be born lacking vitamins as well. And the vitamin deficiency in this mother was so severe that it meant that her baby had really, really low levels of vitamin. And when the baby was born, one of the contributing factors to that baby's demise was a very, very low lack of vitamin D. So what we've been able to do now, based on that, because I went to the coroner, and it's such a simple intervention to make sure that all our babies get vitamin D. Yeah. So now what's going to be included by all health visitors is that every single baby in Manchester, and after that we're going to see if we can roll it out more nationally, is given a dose of vitamin D from the postnatal ward until when they go home. So this will be all GPs, health visitors are involved in this. Yeah, because it's a preventable death.
Yeah. So this is what I take, just to prove to you that I do take vitamin D. You can see it there. So you take at least 1,000 units.
Okay, you have a 25, that's 1,000, so 25 milligrams. I was just looking at the, I suppose this is general update, the one on the coronavirus NHS website.
So this is my tablet. I'm just going to take it now as a proof.
Okay.
I feel better now. Gosh. Yeah.
Okay. While you're here, Yakubu, I think because you know you're ENT doctor, and whilst we've had you know quite a lot of information about long COVID, I would really like you to tell us about some of the innovative and new things you're doing, because I saw a write-up about you with a woman who was suffering from, well, you go ahead and tell the story. It was a write-up in the papers. I was looking up for things interesting about Yakubu, and this came up.
Yeah. So this is a patient that she is in her early 20s, and throughout her life, she's not been able to burp, to belch. So when she eats food, she can't release air at all from the top, and her symptoms has been bloating, gurgling noise in the throat, chest pain, abdominal pain, and excessive flatulence. So she's seen so many doctors. She has seen the gastroenterologist, and they did tests here and there. She saw the GP, and as usual, she was told that she's got irritable bowel syndrome. So when I saw her, I made a diagnosis of a condition called inability to burp, and the medical term for it is retrograde cracopharyngeal disorder. So what happened is the muscle in her throat that is supposed to allow gas to come back up is become tight and spasm, so she can't release the gas. So I injected Botox into her throat, and she has been able to burp one more time. And since then, all the symptoms has gone. Even the symptoms of the irritable bowel syndrome was gone. Now, she was not the first patient that I've treated. I have treated over 70 patients with this condition in the UK. And it's myself and a colleague of mine in Chicago have developed this diagnosis and the treatment. So I do get patients from left, right, and center. Now, it may sound a bit trivial to you that if you can't burp, then what's the big deal? There is a reason why you burp. You burp because you want to release any excess gas from your body. And the quickest way for it to come out is through your mouth, if it is from the stomach, because it's a long route for it to come down from the other end. So these patients, some of them can get admitted in the hospitals with chest pain and they think they're having cardiac problem, but it's not. It's actually this condition called retrograde cricopharyngeal disorder. The treatment is simple. Unfortunately, doctors don't recognize it yet. So GPs are refusing to refer patients on the NHS, and people diagnose this patient as psychological problem, but we know it is not. Recently, I've done an interview on the BBC World Service, Claudia Hammond, on the health check hour. I gave an interview, so you may be able to listen to the interview on my website, my private website. It's over there, or maybe Charles can put it on the CAHN's website as well. And it's so common, this condition, very, very more common than we think, really.
Yeah, I put the two patients that I found that had been you treated. I've put the links to that because I found it fascinating. I myself had never heard of the condition until I saw your write-ups about it.
Yeah.
But these patients were in agony, and so if you are, and that's the other message I always leave us with at the end of our sessions, is that the best person who knows about changing their own body is you. So if you think things are not right, even if you've been fobbed off and you think things are still not right, you need to go back to your GP.
Yeah, you need to go back, because really, I mean, some of these patients actually, I've had a couple of the patients, they attempted suicide because of this problem, because of the amount of pain. When they eat food, they have to lie down on the floor. They can't go out with friends to have meal. They can't have any fizzy drinks, any beer as well. So it's a very serious condition. And the way these people found about me is because just Googling. So if you have a condition that you're not too sure of, don't just sit back, Google about it, get some more information, go press on your GP. And if you don't get solution, look for second opinion. Yeah, if you think you're not getting the answer that you need about your health, you must go for a second opinion. Yeah, don't sit down and suffer in silence.
Okay, thank you. Someone's asked, is there any research, do you think, on the effects of COVID after having a hiatus hernia?
No, because there shouldn't be any relationship between hiatus hernia and COVID. So a hiatus hernia is really at the junction between the esophagus and the stomach. The valve there is weak, so part of the stomach comes back up into your chest, and that can present with reflux. So you may have gastrointestinal reflux disease. You may have soreness in your throat and pain as well. And the treatment for the hiatus hernia is normally anti-reflux medication like lansoprazole or Gaviscon. In some patients, you may have an operation to put like a tight muscle to wrap your stomach around the esophagus. So there are different types of operations for that. But there's no study to establish any link between that.
Okay. There's some other questions that I've missed out. I'm seeing more questions. So one of the questions is about if you have sickle cell disease, should you take the vaccine?
Again, so far there is no contraindication for that as well. But normally when you go for the vaccine, there are questions, and then there are contraindications that the nurse or the doctor or the person doing the vaccine will ask you. So if you're not sure, just go. There are a whole list of questions that you'll be asked, and if your condition is contraindicated for the vaccine, they're not going to give you the vaccine. So I'll feel free and go. If you have any condition you're not too sure of, go to the vaccine center. They will analyze it and will advise you appropriately.
Thank you. Now this is an ENT question. I think when we're talking about anosmia, lack of smell, You
Yeah.
said about being at the top of your nose, and this Lady M is asking, you say that COVID sits at the top of your nose. What's the difference between sinus symptoms and hay fever, which is intermittent snoring, chest symptoms and sneezing?
Right. So first of all, hay fever is an allergy reaction whereby your body produces too much of the antibodies or to clear any allergens, say grass or mold or house dust mite, or it may be that you're allergic to cats. But for hay fever, it's normally seasonal, so certain grass can make your body overreact and produce more cells in trying to clear it. And these cells will attack the lining of your nose, and it will produce secretions which you blow out your nose all the time, and your nose gets blocked. So this is what a hay fever is. So sinusitis, however, it's anything that blocks your sinus will cause sinusitis. And the symptoms of sinusitis are pain across your forehead or between your eyes or around your cheekbones, diminished or loss of sense of smell, nasal discharge, and blocked nose. So a hay fever can cause sinusitis. Yeah. So if you have hay fever and it blocks your sinus, you will get sinusitis. So it's not like hay fever is completely different from sinusitis. They can coexist. And the commonest cause of sinusitis, again, is allergy. So this may be unrelated to hay fever. You may be allergic to pets. You may be allergic to house dust mites. You may be allergic to molds as well. So that can cause blockage of your sinuses. And because the sinus is not draining, you have pressure pain and you get pus and infection there. And with time, that can develop into polyps. So polyps is just swelling in your nose due to allergy. And the treatment is steroid spray if there's polyps. But for simple hay fever, antihistamine tablets is the treatment. You can get it over the counter. And the way it works is it reduces your body from, it reduces the immune system producing too much antibodies into your system, which is the cause of the problem, really. So it's not the pollen that is causing the fever; it's your immune system that is causing the problem.
Another question is, if you wanted to have a second opinion, you know, we've talked a lot about it's your body. You know that things are not going well. You've been to your GP and he fobs you off. If you want a second opinion, how do you go about getting that?
Ask your GP. Your GP has he has a duty. He or she has a duty, if you're not happy, to send you for a second opinion, either with another GP or with another specialist. So your GP has a duty, if you don't get recovery, if you're not happy, to send you for a second opinion.
Thank you.
They're paid to do that, so don't let them fob you off.
Okay, thank you.
It's their job to do that.
That's helpful. You know, when we talked about the vitamin D dose, would you advocate that people go and test their levels of vitamin D before deciding what vitamin D levels to take? Or
not necessarily, because the level may show you to be normal, but actually you have sort of at a sort of borderline level. I will just take it because we know that it's been proven time and time again, really. But if you're one of those people that you really want to be sure, you can take it before you take it. Yeah, you can go test it, but it's most likely that the level will show on the blood system to be normal, but actually pathologically you'll feel fine in yourself, and there may still be an issue there. So the level in the blood test is not 100% accurate per se for us.
Okay, thank you. Cicely, you've asked with regards to vitamin D, you're taking a multivitamin preparation. Now, on the side, I'm not familiar with that particular one, but on the side of the bottle or the box, it will write the specific details of how much vitamin D are in that preparation. So based on the fact that we've said that the minimum should be 100 international units, in actual fact, you should take a lot more because Dr. Yakubu just popped his tablet in his mouth, which was 20, what was yours?
25 micrograms, so 100 units, 1,000 units.
1,000 units. Yeah. So we know that it will, what the government recommendations are, the basic, that's the minimum you should be taking, and you can take a lot more. So just look on the box that you have to see how much vitamin D is in your preparation. And if it's anywhere between that, then you're good to go.
Yeah, I think the problem is with the multivitamins, the dosage of the vitamin D is not high enough. And if you're gonna rely on that, you really have to eat a whole chicken bone to compensate for that.
He said, I have vitamin tablets that I take daily, but someone else has been given 1 tablet every 2 weeks. Is that okay? Well, I think, Teresa, that it depends on the dose. Someone says theirs is 65 micrograms. Is that too much?
I think probably not. If you have if you have vitamin, I think if you're going to go for such a high dose, it's good to check whether you've got vitamin D deficiency first, because that would be like a therapeutic dose.
Yeah, you need to check. If that's been prescribed, then that's probably that you have a deficiency, but that's quite a lot.
Yeah. So it has to be on prescription, that dose.
Someone said, should we stop taking vitamin D in the summer?
Well,
No.
unless if you can spend at least 8 hours in the sun, yes, you can do that. But if you can spend up to 8 hours in the sun, take your vitamin D.
Yeah, I don't think that we have enough access to sunlight, and
Yeah.
also we have darker skin, so it does stop it from coming through. And Charles has put a really good link. So if you can click on that link so that it saves it to your computer or your device now before we go off air. That's some information about vitamin D supplements and how to take them safely. Okay, and I think there was one more. Yes. So as we're about to wrap up, if you can just emphasize about prevention, how to keep yourself safe from long COVID.
So prevention is better than cure. So first of all, the simple hand hygiene, wearing your mask, social distance, just 3 simple things will stop you from catching COVID. And then you add your vaccine on it as well, get the 2 doses of vaccine. Then hopefully you'll be invisible to COVID infection for the foreseeable future. So those are the simple steps that you need to take to keep yourself and to keep other people safe as well. So let's keep it simple. Hand hygiene, social distancing, your face mask in public places, get your vaccine. It's not a lot to ask you to do. So if you do these simple steps, you will protect yourself and others as well.
Thank you very much, Charles. I think for the different questions about the vitamin D, I think if you can just follow the links, because there'll be some individual circumstances, and I think these links will tell you the range of vitamin D. And if you're outside that range, it would be helpful to have a more detailed discussion with your doctor. But yes, Dr. Yakubu online took 1,000 international units, and he's still here. You're feeling okay?
I'm feeling okay,
You're
absolutely.
feeling great.
Yeah, I feel strong now. Look at that. Oh, macho man.
Yakubu, thank you so much for this session. And next week is the 6th of March. And as you may know, that International Women's Day is on the 8th of March. And so what we're going to do is try and bookend International Women's Day with 2 women's events, because as you know, women are very, very important. So next week we're going to have a GP who is going to tell us about what are the symptoms of womanhood that present in her clinic as a GP, as a frontline first person that you meet. She's an excellent speaker. Her name is Dr. Ikpo, and she's going to come and tell us about the common symptoms that present in a GP practice. And then we move after our International Women's Day event on the 13th of March to a consultant gynecologist who works at Royal Bolton, who's going to be talking to us about periods to menopause. So all the things that affect young women with their periods and all the symptoms and what you need to do about the menopause. Charles, have we got the link to our International Women's Day event? Because that's going to be a fantastic...
Yes, Elizabeth has kindly posted it in the chat box.
And I hope to see you all next week. at all our 3 women's events. And as usual, if you've got any questions or anything that you'd like us to address in the future, any topics that you'd like us to cover, please let us know. We've, after that, I think we have a month of, the month of March is devoted a lot to women, because on the 20th, we've got Dr. Ame, who's going to tell us about skin and hair wellness and things that commonly affect our skin and how to keep it looking fresh and beautiful. And the week after that is sexual health, because that's important too. So I look forward to seeing you all in the coming weeks. And if there are any areas of health that you want us to have and invite experts to, please let us know. So enjoy the rest of the afternoon.
Yeah, just to say that on the Monday, the 8th of March, for our International Women's Day event, we're looking at how to break intergenerational, trauma. So, I mean, there is evidence to suggest that if a woman has challenges during pregnancy and in childbearing, it's more likely that her children, might also have that. And we're going to hear a couple of stories from our Black women, and then we're going to have experts in there as well. And we want to start some piece of work on that. So it will be great if everyone could book and share the link with your colleagues. But, to Ngozi and Dr. Yakubu, thanks for your time. And, we're really grateful to have you on the front line, but also telling us exactly what you see on the front line. So we're really grateful for that. And, we look forward to seeing most of you next week. So, the message is clear from our doctors, look after yourself. If you offer the vaccine, take it. I've had mine, Dr. Ngozi's had hers, Dr. Yakubu has, Auntie Elaine on there has, Faye Bruce, our chair. And by the way, she passed her PhD this week. So many congratulations to our chair, Dr. Faye Bruce, and it's her PhD that started CAHN. So, her PhD is a living, piece of work. And in due course, we're going to celebrate her for that. So thanks, everyone. Look after yourself. Have a great and a wonderful weekend. And we look forward to seeing you on Tuesday. As the, doctor said, come for the physical activity and also the nutrition session. We talk about salt, we talk about sugar levels, the fats and, healthy cholesterol, bad ones, and, the portion, we keep talking about the portion because, for some of us that we had things measured for us back in Africa, because we can buy a lot here, we want to eat in large quantities, but it doesn't always help. So please don't miss our sessions on Tuesday evenings between 6 and 7 o'clock, for our Healthy Hearts 1. And then on Wednesdays between 2 and 2:30, you take a break during the day, 30 minutes for another session of physical activity. And then we'll see you on Saturday. So thanks, everyone, and enjoy the rest of the weekend.